Welcome to Harley Street Beauty, the brand new show which gives you all the advice you need to look and feel gorgeous. We'll be revealing the top beauty tips and secrets of your favourite celebs. As usual, we'll also give you exclusive insight into the fascinating world of cosmetic surgery, following a patient as they undergo a complex operation. But before that, here's what else we've got on today's show. Get celeb-style brows with the eyebrow queen herself, Naomi Isted.
Celebrities aren't hiding the fact they've had it done.
We're back in theatre for a pioneering eye guide neck lift procedure.
Face drops, and it does tend to cause the loosening in the central part of the neck.
Hair extensions with award-winning hairstylist in London. My hair at the moment looks so phenomenally natural and full. One of the key factors that can transform the face of every bride-to-be is eyebrow shape. One of the most exciting trends is undoubtedly the increasingly popular HD brows, a technique pioneered by Naomi Isted, internationally renowned as the eyebrow queen. So who better to educate us on HD brows than Naomi herself? I'm here in Milton Keynes to meet with Naomi Isted, the queen of eyebrows. The celebrities love her for a 7-step eyebrow technique. It's known as the HD brows, and I'm here to try and test it. I can't wait.
Well, over the years of being in the beauty industry and teaching as well, I just noticed there was a lack of design skills taught at college in brow shaping. So I decided to actually put a course out. A lot of people were asking me to teach my method of shaping. So we started teaching the basics in eyebrow shaping and put a name to it and branded it and called it HD brows. It's just a method. HD brows is a method I've always used, and I've always done had a lot of celebrity clients, and they've always sort of said to me, why don't you put this out there, get it out there, make it into a brand? And I've done that, and I think it's just word of mouth. Celebrities aren't hiding the fact they've had it done, so a lot of people don't want to talk about what they have, but they seem to want to let everyone know that they've had HD brows. It's like the new label. Our first step is a consultation, so it's really important between myself and the client to know what they're wanting to get from their brows, and we explain the full procedure to them. What sort of brows are you looking for?
It's just really to make them really nice and sleek, and you know, obviously to frame the face as well.
Rather than aim to get a shape immediately that's perfect, because then we end up losing a lot of hair. Right. What we do with HD brows is we get you on a regrowth program, and every time you come in, we'll leave in little bits of little areas to grow in. And then we tint, we wax, we thread, we tweeze and trim. So they're all traditional methods of colouring and shaping. And then it involves a lot of aftercare as well. So with clients, we don't look to get a shape all in one go. Sometimes we'll look at having a long-term shape. A treatment takes about half an hour. The average treatment is about £30. Okay. So it will vary depending on where you go. They'd look at coming once a month to have the treatment. So if they're on a regrowth program and we need a bit more hair to grow in, they've got a slow regrowth, they'll come maybe every 5 weeks. But somebody has a fast growth, will come every 2 to 3 weeks.
As we age, we seem to take it as a given that the skin around the neck area is destined to sag and lose definition. But a relatively new and innovative procedure called the eye guide neck lift offers natural looking results with virtually no scarring. So is this something you'd consider?
I consider anything once apart from Morris dancing or incest.
My mum's had 2 facelifts. Absolutely her choice, you know, she had money at the time, she was unhappy.
I don't know how much of your facial expression you keep afterwards.
You see, I can't say that it's wrong to do because I may get to 50 or 60 and I may want that done. And if I want it done, I'll most likely do it to look good.
This procedure is also suitable for those whose skin has sagged or loosened as a result of significant weight loss, or for patients who have had previous facial cosmetic surgery that has not lifted the neck. Let's head over to Harley Street Plastic Surgery and find out more.
Facelift is a term that we use to actually sort of tighten up people's loosening jowl areas on the face and also round into the neck. Today's case was a lady in her 60s who felt that she was prematurely aging, and she was in a social set that was more dynamic, and she felt that she was being left out. And as commonly happens when one has the operation, a whole group of them have it. She was the sort of second on the line. And basically all we've done really is tighten up the jowl area to pull that up, to give it a little bit more fullness in the area around the cheekbone area. And that's also given a tightening around the corner of the mouth, which effectively means that she doesn't have that sort of sad look. And that's what we call mini lifting now. An aggressive facelift was a process where we've lifted all the skin off the face and pulled that up, and the complication rate was incredibly high. So with the mini lift you get exactly the same result with hardly any risk really. A little bit of bruising in front of the ear perhaps, but that's about all. And no risk really to any of the nerves in the face which could actually move and paralyse you. So basically a facelift is a very, very good operation. It's not the sort of operation for somebody who wants an incredibly tight face. For those sort of girls you've got to do aggressive surgery and you have to keep on doing it. You don't just get it away in one, you usually have to do it 2 or 3 times in a very short period of time. Very rarely do we do that, and most British ladies tend to sort of go from an area about their eyes down to the neck. And then obviously we did the neck, and the neck was really what she came in for, because as I said, the face drops and it does tend to cause the loosening in the central part of the neck. So what we did there was what we call an eye guide platysmoplasty, which whilst it's relatively new, meaning that the public don't really know it's there yet, it's a very good technique, much less invasive than what we used to have, therefore there's less risk. And it's done, it does look as though it's quite a involved procedure, but it's actually quite simple. The idea is you free the skin and the fat away from the deeper structures. You take away the redundant fat that's in the neck, and then you use a stitch which never dissolves to actually pin the skin down to the muscle that's in your neck, what we call the platysmal muscle. So platysmoplasty means a tightening of the neck muscle, and the eye guide literally is a technique we have with a fibre-like rod to guide a stitch in the right plane to allow a trampoline type pattern to be created on the neck. And that gives us what we call the neck definition. It gives us a high angle and a flatter piece under the chin. There does appear to be rather a redundancy of skin, if you like, in the neck. That's what we call puckering. And actually, if you don't see puckering at this stage of the operation, it means your operation isn't going to be a success. You've put it in too loosely. So a little bit of puckering is normal, and within a week or 2 that's all completely freed up. And what will tend to happen after that is it'll look great for about 6 weeks, and then it'll indurate for a bit, go a bit lumpy, and then over the course of a few months it'll all settle down. But the lumpy bit you'll only really see when you try and force your neck into the air. So you put your chin right up, it tightens, it'll feel tight, but in the neutral position as you're talking to everybody, she should have much better definition now than she had before. So actually I'm very pleased today, and I'm sure she's going to be very happy with the outcome.
It's time for our home beauty part of the show now, where we tell you how to get celebrity chic right from the comfort of your own home with the help of our in-house team. If you've ever wondered how to take your makeup seamlessly from day to night, you're in luck. Makeup artist Jules Cardoza-Marsh is one of the UK's leading makeup artists.
So what you want to do is follow my easy tips and turn your daylight makeup into all-night makeup. The first thing to do is get a cotton bud and literally just dust off any mascara that's fallen onto the face during the day. You don't want to reapply your foundation, so what you want to do is just get your concealer and just literally go over the areas on the skin that you need to touch up on. Concentrate under the eyes and just touch up the area on the chin. Just use your fingers and smooth it all in. If you want to, you can use a little bit of loose powder just down that T-zone to stop any shine. The look we're going to create today for Naomi is a smoky eye look. Just use a little bit of light colour as a base, and then you can build up as you go. So if you apply it to the lash line, and then with another soft brush, just blend it in. You can do the smoky eye look with any colour, doesn't have to be black, you can do browns, purples, whatever suits your skin tone, so just go for it. As long as you don't go too far above the socket Okay, it's great for all eye shapes as well. And literally, in the outer corners, just add your darkest colour. But underneath the eye, if you just literally run your eyeshadow with a very fine brush right underneath, from your outer corner to your inner corner. And then with your eye pencil, which we use in browns, again, just get Naomi to close your eye, and you're just literally going to run the eye pencil against the top of the lash line. With your fine brush again, just smudge it down, and this is how you build up the smoky eye look. You've already got mascara on, so you don't really want to apply too much. All you want to do is just add a bit of drama for night time. So just Naomi will look down for me, and again, just add a little bit to the ends of the lashes. You don't want to apply too much, that's the trick. For this look, for night time, we're going to use bronzer because it will give a really nice glow. Apply to the cheek area. You can contour in if you want to as well. The only thing I would say about using a cream blusher is if you've got oily skin, it tends to soak in, so it's best to use powder. And all you've got to do now is your lips. So this is a coral colour which will look lovely with Naomi's tan. Just fill in. If you want to use a lip liner, that's great. If you don't have time, it's fine. Most important, if you want to add a little bit of gloss, just dab onto the lips. Gives a really nice shine. That's how we turn our daytime makeup into our nighttime makeup. Now Naomi's ready for drinks.
Welcome back to Harley Street Beauty, the show that helps you look and feel amazing. Coming up on Harley Street Beauty, we get the lowdown on teeth whitening at Aviva Cosmetic Dentistry.
Personally, I prefer the home bleaching way of bleaching teeth.
We head to In-Anch Hair Salon to get expert advice on hair extensions. I'm looking forward to this transformation.
I know.
Thank you. Nowadays, it seems like having whiter than white teeth isn't just something that film stars want. Everyone wants to get their teeth pearly white and shiny. We talked to the public to see what they thought.
Teeth whitening, alright, I think.
That's quite a good procedure, and it's not as much as other stuff.
I think there's again a fine balance. I think if you look at what America does, I think it's almost too white and it doesn't look natural. But I think if you can get them cleaned up and done, yeah, definitely look for that.
Teeth whitening is one of the most affordable and easiest cosmetic surgeries around. You can pick up home teeth whitening kits for less than a £5. We visited Aviva Cosmetic Dentistry to find out the latest developments in teeth whitening.
There are two main ways of bleaching. One is with a laser bleaching, which is used in the surgery, and the second way is home bleaching, which is in a tray that you wear predominantly overnight, and that takes about 2 weeks to bleach. Personally, I prefer the home bleaching way of bleaching teeth because it uses a very mild product. Carbon peroxide is the chemical, and this breaks down into hydrogen peroxide, and that's what's required to use that oxygen to penetrate the teeth. With laser bleaching uses, again, hydrogen peroxide, but it's 40% hydrogen peroxide. And this is really quite a strong chemical. If it's used by a dentist carefully, it's safe, but if it touches any tissue which hasn't been protected, it will blister. And so the dentist will put a barrier on the gum and a barrier on the lips to protect those. Once we've got these impressions out, I will get the trays made, and the trays will take about 2 weeks to be made. Then you'll come in and we'll explain to you how to use the trays and how to use the bleaching product, which you'll wear for night time, preferably overnight, for 2 weeks. And then 2 weeks later you'll come back and see me, and we'll make sure that the process is completed. And actually at that last visit we tend to have you in for an hour, where we will apply a slightly stronger bleach within the tray to your teeth. And that just gives a little bit of an oomph and makes them look even whiter. Once you stop bleaching, you will find after a year, maybe 18 months, that actually the teeth start to darken a little bit again. With the home bleaching kit, you've got that tray, you can put a little bleach in, and over a couple of days you'll go back to the original whiteness, which is great. Many of the public have seen it on news programs, magazines, and we get a lot of people inquiring about it. A simple way of doing it involves using bleaching product, predominantly hydrogen peroxide, and this is used to oxygenate the teeth. By oxygenating the teeth, it actually whitens the teeth. It penetrates all the way through, from the enamel, through the dentine, through to inside the tooth. It will last you probably between 6 months and 18 months, the bleaching, but each patient's different. We don't know how much oxygen will be taken into the tooth. It's the oxygen which makes the teeth whiten, and each patient is different. A lot of bleaching is available online. You read it in the magazines. You can go to, say, a beautician maybe and have it done. Well, actually, bleaching should only be done, legally only be done, by a qualified dentist.
If you've ever had hair extensions or are considering them for your wedding or for more length or fullness, don't move a muscle. Award-winning hair extensions expert Inanch Amir has built a global reputation for delivering amazing results. I joined her in her West London salon to get her top tips on hair extensions.
With so many hair extensions products on the market nowadays, we've come to leading London salon Inanch London to find out more about hair extensions, tips, advice and everything you need to know from award-winning hairstylist to the stars, Inanch. Hello Inanch, lovely to meet you.
Nice to meet you.
So we're very excited to see, well, obviously the transformation that you're going to do for me today.
Can't wait.
I can't wait either. Okay, so how long does it take to fit a full head of extensions normally?
Well, with me, it's about 3 hours. It can be anything from, a full head is anything from 100 strands to 250. There are clients that will have more than 250 strands, but we don't recommend it. And if a client does come to us and say, I want 400 strands, we do try and put them off, because one, it's going to cause more hassle, and also it's going to take you longer to look after. If you're not used to long hair, then we definitely don't do it. But if you are one of these people that are used to long hair, then we might sort of bend the rules a little bit and say to you, okay, we'll do 250, live with it for a week or two and come back and we'll put the rest in at no charge. Obviously, if they've already paid for the hair, we won't charge you extra for the service, because we'll do it in 2 installments if you like.
Fantastic. Thank you so much. I'm looking forward to this transformation.
I know.
Thank you.
I've been doing it, I'd say I've been doing it for about 15 years now, but I'd say in the last 10 years I've been using purely great lengths, and they use a keratin bond, so it fuses better with the hair. You don't get the shedding, and when you do go to remove it, you use a special removal solution and a tool, and it just crumbles away, as glue used to get sticky and you used to pull the hair, which obviously used to get bald patches. And things like that. The reason we tend to work with mainly great lengths is because, one, it's Remy hair. It's 100%.
What does that mean?
Basically, when the cuticle is intact. So what sometimes happens in some salons is they take hair from brushes, so then they strip the cuticle because they don't know which way round it is, which means it has no cuticle. So then when it's applied to hair and the hair is washed, it almost goes like you've backcombed your hair.
Kind of puffy. I've used extensions for years and I never thought it could transform your look and look so natural. It's absolutely stunning, so thank you so much. I'm lost for words. just incredible. My hair at the moment looks so phenomenally natural and full. Thank you very much to this salon for educating us on the do's of good extensions. If you want the best tips, hints and secrets to looking and feeling gorgeous, we're here to help. Bye for now.